Morning to one more present, respected sir and my dear friends. So today my topic is yoga and menstrual health. So before starting this topic, let us understand what is yoga, like how yoga help in menstrual health. What is yoga exactly? So yoga is a physical, mental and spiritual practice that originated in ancient India. It is coined by the sage Patanjali in his Yoga Sutras around 400 CE. So the word yoga is basically derived from the Sanskrit word that is yuj, and which means to unite. So this practice aims to create union between body, mind, and spirit, and as well as between the individual self and universal consciousness. So when we do yoga, when we go for yoga, then it helps us to utilize ego-driven thoughts and behaviors, creating a sense of spiritual awakening. So that is what about what is basically the yoga is. Now next. So there are few applications of yoga that sir has already discussed with us. So the applications are medical, health and well-being, social, personal, cultural, business, spiritual, research, building nation. So these all are the applications of yoga. So today I am dealing with basically the health and well-being part. So here I'll be discussing about the like how yoga improves the menstruation health of women. So basically we are dealing with that. So first of all, before knowing this topic like briefly, so we need to understand what is menstrual cycle is. So menstrual cycle typically lasts up to 28 to 29 days. So menarche is the name for the first period. So menarche is the a period where a child or a girl child will receive her periods for the first time, and it will basically between the age of 12 and 13, and sometimes it can be seen from 9 to 16 years. So menopause is the time after the last period. So basically menopause is the stoppage of the period. It is basically seen in the like 50 to 40 to 45 or 50 40 to 50 time age gap. So menopause is the time of the last periods, and menarche is the name of the first period. Next, phases of menstrual cycle. So there are typically 4 phases of menstrual cycle. So first is menstrual phase. So this in this phase it is basically lasts from 7 for at least 7 days. Here the uterus lining actually breaks, or you can say shed. So when the uterus lining breaks, then there will be discharge of blood, and this discharge of blood from the uterus, it is called as menstrual phase. Next is follicular phase. So here the follicles will create a it will generate egg from this follicular phase, and third is ovulation phase. So here we can see in our female reproductive system there are 2 ovaries. So from each ovary there will be like from any one of the ovary there will be releasing of one egg. So here in ovulation phase the egg will release from one of the ovary, and it will travel from the fallopian tube to the uterus. So here the ovulation happens like that. Like this is the uterus. So here from the ovary it will travel from here. So this is the phase where pregnancy basically occurs. So when the egg will get fertile with the help of this sperm, then after that this pregnancy will happen. So this is basically ovulation period, and last is luteal phase. So here the corpus luteum will produce some hormones such as progesterones and some amount of estrogen. So this progesterone helps the uterus to thicken the uterus lining. So when ovulation will happen, it will lead us to have pregnancy, and this uterus corpus luteum will help the uterus to thicken the uterus lining, and it will help for the further development of the pregnancy period. So if the egg doesn't fertile with the help of this sperm, then this lining shed, and after that the blood will flow and again menstrual phase will be started. Now, what are the menstrual disorders? So, some are the disorders that basically faced by several women in today's generation. So, these are the disorders. First is dysmenorrhea. This is painful cramps. We basically faces cramps in our uterus part or reproductive part during a period. So, this is the disorder, painful cramps. Then next is menorrhagia, then this is heavy bleeding. So sometimes while periods, heavy bleeding, heavy discharge of blood will happen. So next is absence of menstrual, absence of sorry, it is repeated again. So absence of menstruation. This is also called as amenorrhea. So here these periods will be totally absent. So it will come like 2 or 3 months after that. So next is infrequent menstruation or oligomeria and hypomeria, light menstruation. So it is the period where the blood flow will be somewhat lesser, like it will be like a pinch of showing like a thing. So next is premenstrual syndrome. So it is called as PMS. So it is also a menstrual disorder. So these are the disorders. So how we can treat this menstrual disorders? So there are some of the yoga poses that we can continue or we can adopt while while periods. So this is first is cat pose. So here you can see in this picture. First we have to do this, then we have to do this. So it is also called as Marjari Asana. So this pose tones and relax the spine and abdomen. So during periods, we often find that our spine and abdominal are we find pain in this portion. So here this pose will help us to reduce that. Second is child pose. So this pose basically calms the nervous system and shortens the back. So in periods you basically have this back problem. So I too also have this back problem while periods. So if we continue doing this during periods, then it will remove the disorder. Then next is cobra pose. So this asana is great for blood circulation and relaxing the back. So during periods, we basically lay in the back for the whole day sometimes. So it may reduces the blood circulation in our body. So when we do this pose, then this asana is very grateful for this blood circulation in our body. Next is bow pose. So it is ideal for menstrual discomfort and removes fatigue. So when we are having fatigue in periods, then this asana will be very beneficial. Next is fish pose. So this asana stretches the if you follow this asana, we need to stretch the chest and neck, and great for it is great for releasing tension. So when we are having tension in periods due to several hormonal imbalance in our body, so we basically have this tension and stress during periods. So this asana will helpful for releasing the tension in our body. Next, corpse pose. So this posture brings a deep meditative state of rest, which may help in the repair of tissues and cells and in releasing stress. So releasing stress, this asana is also helpful. Next is alternate nostril breathing. So it releases accumulated stress in the mind and body effectively and relaxes it. It also helps to harmonize the left and right hemisphere of the brain, which correlates to the logical and emotional sides of our personality. So this asana is also helpful for relaxing our stress and all. So in conclusion, I would like to say that dedicated practice of yoga as a way of life is no doubt a good recommendation to medical prevention and also a yoga therapy. So it is very important that along with practicing asana, individuals adopt stated yoga principles and help patients to understand them and integrate them into their lives. Yoga have to be a method for resolving symptoms, but a serious proposal for prevention as well as a good method in the process of healing and rehabilitation. Uh, that is all about the menstrual health. Like how yoga is helpful to improve our menstrual health condition.